The broadcast is now starting. All attendees are in listen-only mode.
Hi, everybody. We're just going to wait a few minutes because I know we've got some participants who are still logging in. So thank you all for being here, and we look forward. We'll start in a minute or two.
Hello?
Great. Thanks, everybody, for waiting for a few minutes. Wanted to make sure everybody who had a chance could join. Welcome and thank you to everyone for joining us for today's PSE Implementation and Strategies in Action webinar. Today we're going to be focusing our presentation on collaborative partnerships. I wanted to introduce myself. My name is Vanessa Thompson and I'm on faculty at UCSF. I've had a chance to meet many of you, but thank you for having a chance to collaborate together online. So I want to just make a few notes about the agenda. Before we get started today with today's presentation, we wanted to review a few housekeeping items and provide a few programmatic updates. The presenters today are going to be Melissa Peters from ChangeLab Solutions, who's going to begin our webinar with a brief overview of key elements of partnerships. Following Melissa's presentation, we're going to be joined by our two guest presenters from San Mateo County. The first one is Dr. Rachel Borovina, who is a Champion Provider Fellow from San Mateo County and a pediatrician at San Mateo Medical Center. She's going to be joined by her LHD partner, Gloria Gonzalez. Gloria is a community program specialist at San Mateo County Public Health Department in the Nutrition Family Health Services Division, which is their nutrition, education, and obesity prevention division. Gloria and Dr. Borovina will discuss how they've been able to leverage their partnership to advance community change efforts in San Mateo County. We'll then conclude the webinar with a question and answer period, and all attendees will be muted throughout the webinar. Please input your questions into the chat box that you can see on your screen during the presentations, and we'll read them aloud for the Q&A session with the guest speakers so that everybody's questions will have a chance to be answered. Feel free to go ahead and ask your questions during their presentation, and we'll keep track of those and can ask them during the Q&A session. A full recording of the webinar, including slides, will be made available to everyone to access after the webinar. So we have a couple of programmatic announcements as well. Wanted to let you know that we are absolutely thrilled that we are recruiting for our third cohort of the Champion Provider Fellowship. And as you can see on the screen there, we've got our timeline for the cohort for 2019, the recruitment process. We're letting you all know about this so that you can hopefully participate in recruitment. If you know anything, anybody who you think would be great for this next cohort of Champion Provider Fellows, please reach out to them or connect us to them. And we are absolutely happy to have conversation with folks to explain the program better. We also have materials that are available that you can send out to folks. I think key dates to keep in mind are the application is going to open online October 1st. The deadline to submit the application is December 15th, and we're hoping to have the cohort announced by the end of January so that incoming fellows can plan for the 2-day onboarding training, which will be at the end of April based on those dates you see there on your screen. For any questions you might have about the process, Jessica Davidman is available, and her contact information is going to be available to you at the end of the presentation. So I'm going to hand it over to Jessica now for a couple of additional program announcements.
Hi everyone. Okay, so just a couple reminders about upcoming events. At the end of August 29th, it's the statewide call to action called Healthy Snack Day. Hopefully everyone's already heard of that, similar to Rethink Your Drink Day, where different organizations can participate and you can access materials online. Then September 11th, we're having a media training that's for fellows. That's going to be September 11th in Oakland, an all-day in-person media training. Then on September 12th, we have our bi-monthly LHD call, and that is for our participating LHDs. We did email and send information in the newsletter. If you need registration information for that, you can contact me as well. Same with September 25th. This is a work in progress call number 6 for fellows. It's a series of calls that we have, and we have Alicia Fernandez giving advice and answering questions for any of the fellows. We love to have fellows present what they're working on, ask questions. It's really great to get feedback from your colleagues. And I sent that registration information out as well, but please feel free to contact me for the registration information.
Great, thanks so much, Jessica. Now I am thrilled to introduce our first presenter, Melissa Peters. Melissa is a policy analyst at ChangeLab Solutions, which is one of our partners with the Champion Provider Fellowship. As many of you have seen the PSE playbook that we developed in collaboration with ChangeLab Solutions, and we're thrilled to be able to continue that partnership. Melissa did a spectacular job hosting our webinar in June for those of you who had a chance to participate in it, and we're thrilled to have her back. At ChangeLab, she works to support agencies and communities working on policy issues related to tobacco control, childhood obesity, and community planning. Prior to joining ChangeLab, she worked as a health education specialist for San Luis Obispo Tobacco Control Program, where she focused on community advocacy. She developed tools and resources and assisted jurisdictions interested in tobacco policy adoption. We're thrilled to have Melissa here to talk with us and then to introduce our 2 guest speakers as we discussed prior. So Melissa, please go ahead and take it away.
Thank you very much, Vanessa, for that beautiful introduction. As Vanessa mentioned, we're one of the partners in this UCSF Champion project. I'm here representing ChangeLab Solutions. We're a law and policy nonprofit in Oakland, California, who focus on trying to help local communities and health departments and physicians adopt policies for the better good in the state of California and also nationally. So as a disclaimer, because I am not a lawyer and we are not practicing lawyers, anything that we produce in this webinar is not to be considered to be legal advice, but we are here to give consultation to locals on different issues related to law and policy, but we do not enter into client-attorney relationships. And I always have to start with this disclaimer, but I promise you the rest of the webinar will be upbeat and positive. So as an overview of what we're going to cover today on the webinar, we have a really exciting schedule today. I'm going to go over some key elements of collaborative partnerships, which is one of the 7 elements of PSE implementation, also featured in the PSE playbook. We're also going to hear from a collaborative partnership in San Mateo County. We have Gloria Chauchichin Gonzalez from San Mateo County, as well as Dr. Rachel Borvina from San Mateo Health System, who work together in the UCSF Champion Provider Fellowship and at the local level to do some PSE changes. And then we'll have time for a question and answer at the end, so please be typing your questions in the chat box. To kind of go over a little bit about how that Q&A is going to function, we're going to be doing a moderated Q&A, so all attendees are going to be muted for the duration of the webinar. And so we'd love if you type your questions into the chat box. Can you please select to all or to organizers and panelists so we make sure to get your question? If you have a specific question for one of the speakers, make sure to include their name in your submission, and then we will be muting all participants. So as Vanessa mentioned, the real focus of a lot of the work we do with the UCSF Champions program is focused on PSE change. And just a brief overview of PSE change, I'm sure you've heard it once before, and we'll probably hear it again as you work together in this work with the local health departments and the champion providers, is PSE focuses on policy, systems, and environmental change as a way to really shift how communities are being structured with different ways of intervention. So policy is obviously, as the name says, a formal policy written. System changes really kind of focus on working to set up new practices and procedures. They can be voluntary, and they can shift the way that people do business. Organizations do business with the community or within themselves. And environmental changes really alter the physical experience, social and economic way that people are experiencing their environment. And so that's kind of a brief overview of PSE change. For more information on that, I really recommend you look into the playbook, which goes into real detail about each of the elements and some of the pros and cons of each. So as I mentioned in kind of the agenda and introduction, we developed in partnership with the UCSF team what we're calling the 7 elements of PSE change. And today, we're not going to go through all of these elements in detail, but in this particular webinar, we're going to focus on collaborative partnerships or mobilizing partners as one of the elements to highlight. And so when you look at these elements, these are just as a result of some key informant interviews we did with providers and local health departments working on PSE change. We found that the PSE successes that they all contained at least a version of some of these elements. And these aren't linear steps, so you don't have to do 1, 2, 3, and 4, but they provide a bit of structure for any intervention. And so in this webinar today, we're going to focus on mobilizing partners to kind of give some more information about how to work on that element. So now I'm going to launch into an overview of some key elements of collaborative partnerships. This might also be familiar as we do highlight this kind of structure in the PSE playbook. So the three elements of a successful partnership are clear roles and responsibilities, effective communication, and shared goals. And each one is really integral to the success of a collaborative partnership. And in the next coming slides, I'm going to kind of break them down and provide some insight into each of the levels, each of the elements. So clear roles. Clear roles help partners understand their contribution to the collaboration. They help identify what each person is responsible for and can also establish necessary boundaries for each participant to engage in the partnership. And the UCSF Champion Provider Program has provided a really clear outlining of some of the roles that department champion providers can play in a PSE intervention. So the roles are outlined here on this slide: connector, advocate, amplifier, team expert, and leader. I'm not going to go into detail on what each of these roles brings to the PSE change. For that, I encourage you to look in the PSE playbook. But I want to reiterate that these roles can really provide structure to a collaborative partnership, and there's no right way to get involved in these efforts or to assume a role in a PSE collaboration, and it's not a one-size-fits-all, but both physicians and local health departments and other collaborative partners can each assume one of these roles to play a key function in a collaborative partnership. And if you are assuming one of these roles, or you think that you're assuming one of these roles, communicate that to your partner so that you can be sure that you both are understanding where you fit in the partnership and can move forward. So effective communication is the second kind of element to collaborative partnerships. And communication is key to moving much of the work forward. In initial meetings to start a partnership, it can help to outline how you like to communicate with your partners. You can be really direct. Do you prefer to phone? Do you prefer to email? Are you a texter? If you normally check your email in the morning, that's important to communicate to your partner so that they know, if I want a response from this partner, I should email them in the AM. And it might be really important for physicians or those with clinical practice to outline when they're available, when are they most likely to respond, to help set up a clear communication structure. Starting off the partnership with a clear understanding of each of the partners' communication style can also set the partnership up for success. Do you like to process out loud? Are you more of a thinker or a contemplator? Making that clear between a partnership and when you're starting the partnership can help set the tone for clear communication. So shared goals is the third and final kind of element to a successful partnership. Goal setting is really important to a successful partnership as well as a PSE implementation. Making sure each partner understands the intended outcome can ensure any work being done to support the effort is contributing to a shared vision. Just like outlining a communication plan, sitting down to share project goals and intended outcomes can help address discrepancies and make sure all the partners are on track. Also, it's important to revisit these shared goals as you continue through your process to check your progress toward your goals and also make adjustments when necessary. Goals don't have to be static, but provide something to reach for. And as long as every member of a partnership is aligned on what the goal is for not only the partnership, but also the PSE change, real success can be achieved. So to kind of keep it simple, a partnership is really like a good friendship. It takes a lot of time, it takes a lot of energy. You want to keep open lines of communication. You want to share your plans for the future and look for ways to be supportive of each other and their work. Identifying a role that each member plays in a friendship and respect the value of that role as they enter the partnership. And then building trust and investing time and energy in the relationship. So maintaining work partnerships or collaborative partnerships that in our professional life mirror some of the elements that we also put in to maintain some of the good friendships that we have in maybe our personal life. So I'd like to kind of close this more formal section of the agenda with some resources to kind of highlight some of the ideas that we talked about today and provide some additional sources of information if you're interested in looking into deeper ways to collaborate with your partners at different levels. So the PSE playbook, as I've mentioned multiple times, and Jessica mentioned early in the presentation, we've added new sections to this playbook in the second version, including a collaboration section under Mobilized Partners. And to find the PSE playbook, you can go to the website listed on the screen, click the Resources tab, and then you can select the playbook and you can download the electronic copy. Or if you'd like a hard copy, you can email Jessica Davidman at the email provided on the screen, jessica.davidman@ucsf.edu, and she'll provide you with a hard copy. Two resources that we kind of highlight in the PSE playbook are the Collaboration Multiplier and the Collective Impact Approach. So the Collaboration Multiplier is an online tool from the Prevention Institute that provides a systematic approach to laying the groundwork for collaboration across common goals. This tool is interactive and helps organizations understand which partners they need and how to engage them in their work. So it's a really interesting tool that you can use to kind of outline a structure of maybe finding new partners, how would I engage them, what are the steps. The Collective Impact Approach helps guide those ready to make collaborative efforts across organizations by involving a centralized infrastructure to support continued communication and collaboration reinforcement. So if you're interested in other strategies or different ways to engage partners, I encourage you to read this Collective Impact Approach document and kind of get familiar with that way of approaching partnership. These resources links can both be found in the Mobilized Partners section of the PSE playbook and can be really useful tools in your collaborative efforts. So again, to find the PSE playbook, you can go to the UCSF Champion website, click the Resources tab, and then download the playbook. Another way of thinking about partnerships is something that was developed by NACCHO and the Institute of Cultural Affairs Technology of Participation is called the Circle of Involvement. This tool actually helps identify partners outside of maybe the local health department and physician partnership and kind of bring other players in the fold that might be useful to support PSE efforts. So partnerships with local governments, neighborhood associations, schools, community-based organizations are all outlined in this tool. This can be a key tool in identifying the partners that can support your intervention and also looking at what shared goals you have across these different partners. So to download this tool, you can find it at the NACCHO website, and we can provide all links to these resources after the webinar is over. One final tool I would leave you with is a tool developed by ChangeLab Solutions and a partnership of different staff here. It's called a roadmap for health in all policies. This document really outlines the health in all policies approach, and which is a approach that encourages collaboration across government departments and agencies that are all focused on change. The document really gives a roadmap for engaging different government agencies in PSE change. So this is really focused on different departments, different divisions, different sectors of the government workforce. This document goes over the suite of our tools that we have focused in this area and really talks about how to implement health in all policies approach across these departments and provides resources and real-world examples to help ground these ideas in the approach. So you can find these documents by searching for health in all policies on the ChangeLab Solutions website, which is here on your screen. So after you've probably tired of hearing me talking about collaboration in more of a high level and kind of hypothetical way, I'm really excited to introduce this next section of the webinar because we have two representatives from a partnership in San Mateo County who are going to give us kind of more of a real world example of what a successful collaborative partnership looks like within the Champion Provider Network. So I'd like to introduce Gloria Chau-Chichin and Rachel Borovina, who will be our presenters today. Gloria works at the San Mateo County Health System and leads the Champion Provider Collaboration there, the Healthy Parks, Healthy People initiative, also some garden initiatives, and the SHINE project for the Nutrition Education Obesity Prevention Program in San Mateo. Dr. Rachel Borvina is a pediatrician at the San Mateo Medical Center, works in pediatrics. She has supported community-based policy initiatives such as healthy default beverages in San Mateo, and works in partnership with Gloria on other community-based initiatives. I will now hand it over to Gloria and Rachel to talk to you about their collaboration.
Thank you. This is Rachel. I just want to do a quick tech check because we've had some difficulties. Can you all hear me?
We can hear you, Rachel.
Okay, great. So thank you, Vanessa and Jessica, Melissa, the UCSF teams, ChangeLab Solutions, and everyone for inviting Gloria and I to participate today. As usual, Gloria and I are going to be doing a true tag team experience, as not only do we present together, but we're helping each other from a tech side as well. So please bear with us if we experience some tech glitches. And I think also the big point is I'm hoping this discussion today will give us a space to share ideas regarding kind of the real world obstacles we face in partnering, and not just partnering between providers in the LHDs, but kind of really getting things done at both a local but a bigger level. So hopefully we'll be able to kind of work through and chat about some of the challenges that we face. Gloria, did you want to add anything to that?
No, we're ready. Let me know when you're ready to go to the second slide.
Okay, let's go to the overview. So this is just a quick snapshot of kind of what we wanted to touch on. Gloria and I are going to alternate by sharing both the provider and then the LHD perspective. And we just wanted to touch briefly on kind of how we got to know each other and also better appreciating the different priorities everyone brings to the table, how we continually are trying to set our priorities, and then moreover how we're trying to figure out how we will work together and whose responsibility it is to get certain action items done. And then the fifth thing is something I just wanted to put out there is, as Melissa has shared earlier today in the discussion, there's a lot of tools available, different methods, and one of the methods that we kind of use in our county in some derivation is the lean method. And I know many organizations, both especially outside of the healthcare industry, but within the healthcare industry have kind of adopted the lean method. And Gloria and I have had different experiences within our county, but having said that, we have that as kind of a background as to how we're approaching how we're organizing our different projects. So I'll give you my version of the Cliff Notes to what really works for me. Anything else you wanted to add, Gloria?
No, we also happen to match in those thought process with the lean training that we've gotten here in our little unit, and it makes it work really good for both of us. Okay, so the next slide is getting to know the team players. I'll start with the provider's perspective. I think from the onset, what I realized was, even though I've been within our county system for quite some time, I did personally know some of the players joining the cooperative we have, but I also realized that having an idea of the leadership, the organizational chart was very important to kind of facilitate how we were going to choose what we were going to work on, who we were going to rely on for support. And so for myself, from the onset, it was really important to meet with our NEOP, the LHD team, and begin regular face-to-face check-ins. That seemed to help quite a bit. And then the other part of getting to know the local team was, and this was really important, in that the NEOP team had thought about including a health and policy planning perspective and member. And I think having a really diverse group within the LHD team truly helped, not only understanding how we're going to navigate this together, but also the logistics of how are we actually going to get things done.
Lori, did you
Yes,
want to
so
add it?
yes. So from the get-go, once we knew who our champion providers were, we were all on board to have that in-person check-in and to share who we were and share the overlapping goals that we have with our integrated work plan. And so at that first meeting, we just shared our backgrounds, our passions, and at that time, we were already connected to Justin, our health and policy planning person here in the county. And so he, like Rachel said, he has been a really intricate part of our partnership. And I do believe that is very diverse, and we're very well connected and able to move things forward with each of our different contributions. So initially, I just liked that we started doing the face-to-face check-ins and that we got to know each other a little bit, and that's how it has been, over time. So it's been really nice.
Absolutely. And one more point I wanted to add is echoing Melissa's comment on communication. All of us have a variety of different professional and personal responsibilities, and I also am a full-time clinician. And so being able to share with each other upfront, everything from which email that I'm going to be checking versus when I'm more or less likely to get back to you given our different work schedules or our clinic schedules. And if one of us is out of town for one reason or another, just basically giving us a heads up, like, hey guys, I'm going to be offline for these days. So if you need something, can we tackle it before, or just have it wait for our return? And I think that went very smoothly, and establishing that right off the bat was very helpful. So heading on to the next slide, the priorities.
Yes.
Okay. And this was, I think, a very important lesson for me as a provider, because we very quickly had to be very honest about the practical side of the potential projects we all wanted to do. And with that, being very honest about leveraging not only our personal and professional interests, but the resources at hand. And so the LHD team basically provided me with different work plans that were already set. And that was important because I came in with like, oh, this would be great to do X, Y, and Z, and these are the things I'm interested in as a provider and so forth. But the reality is some of these funding cycles or grant cycles or other constraints had been previously set even a year before the fellowship started, and they had timelines and so forth. So I really appreciated that they were able to share with me existing work plans and the reality of some of the things we were locked into or potentially locked into. And then, the partnership building cannot be, understated. Because of funding cycles and personnel and resources, we began to realize that making connections, not only within the county, but with partnerships in the community, were important because many folks had already set their policy agendas for the fiscal year by the time we were all meeting, which was, I think we started meeting after the onboarding, but several discussions had already been made with funding cycles and agendas for the following year. And so this year, in addition to kind of trying to work within those limits, I think we started recognizing that we're reaching out and trying to connect with potential stakeholders were important, because that way, right now, we are at the table at some of those discussions and getting not only sharing our resources, but helping to perhaps influence the agendas in different settings. And that's everything from within the county setting, but also partnering with the YMCA in our community, or the Youth Leadership Commission, and so forth. So even though it's a little laborious and sometimes you kind of want to just get things done, understanding that those meetings and connections with people at the onset can be really beneficial to getting lasting, meaningful change in the future. And then the last part that I just wanted to add on was from a provider's perspective. I came in with ideas that I thought had motivated me personally to pursue the fellowship. And then I realized quickly that many of those aren't necessarily things that we can just go for right off the bat. And then also appreciating, some of the small wins and these small gains that we have that are not necessarily what I thought I initially wanted to do, but have been equally as rewarding and meaningful and very powerful in kind of building the foundation of moving forward with larger policy and system changes. Harry, do you want to jump in?
Yes. So yeah, we definitely have been on a learning curve there with connecting with other non-county partners and making those connections, those important, hopefully long-term connections with stakeholders that we want to work with, and just learning their timeline and being proactive in getting a seat at the table and just being ready when they're ready, because like Rachel expressed, our timelines can be very different. And so even though we want to move things in a certain direction, in a certain time frame, it could be different for our outside partners, and really being flexible, but one way or another connecting and learning about them and what we can work on together. So I like that Rachel mentioned the small quick wins, because we have just this large overarching goals that obviously take a while to see an effect, but celebrating those small wins really helps the group as a whole to motivate us to know that all those little small wins all of a sudden add up to something great that we were hoping for. And one example has been the implementation of the PART prescription here in San Mateo County. That was a goal from the beginning from both of our champion providers, wanting to increase physical activity and increase access in our communities. And we've been at it with different things, and we're finally getting somewhere. And it's been a really, really nice learning journey of just being patient, knowing who the power players are, and celebrating those small things that we are trying to reach out and set in place for when the broader concept gets implemented. So yes,
definitely agree. Cool. And then heading on to the next one was the priorities.
Yes.
I think what we all have been doing is we kind of created parallel tracks, and we were breaking them down into different areas. And these were kind of the general groups. We had the quick wins, which were things that we could kind of start right away with very little upstart, just to get momentum going. Just to kind of get the feel of, okay, change is happening. Let's do these small changes, and some of the quick wins I put down there, and it was interesting because like the Shine program, which is part of the NEOP team, was very new to me as a provider, but because of various connections, it was a little bit easier to do something. Using my insight
so to speak, with the Child Care Collaborative in our county. So just small things like this, like, oh, well, this is actually pretty easy, I think, in the scheme of things. And then Gloria was great as she kind of drew upon a burgeoning relationship with our county parks. And we just said, okay, let's just start something. Let's just set a date and go. And it's not going to be perfect, but we just got to start something. And so we were just kind of doing, all right, let's just get these things going. It's not going to be perhaps our ideal rollout in every capacity, but we just need to start. And likewise, Gloria and her team had already been doing food tastings and so forth, and kind of how we can pair that into kind of an ongoing kind of augmenting the existing projects with additional ideas like the Healthy Snack Days and back to school and so forth. And then the calls to actions were things that I think which I feel as a fellowship has been helpful for, because everything from kind of getting news flashes and helping a provider have a more streamlined and efficient way of understanding what's happening in the broader political stage has been helpful, because oftentimes, at least for myself, as a full-time clinician, I don't have a lot of extra time to be constantly checking both local, state, and federal policy changes and or potential laws or ordinances that are coming down. But when it came up, they're obviously very time sensitive. So having those kind of things roll out have been helpful. And then the kind of the longer term strategic planning that we talked about, and these were more somewhat tied to funding priorities and just available resources, including personnel. And so this is just a quick snapshot of some of the small projects that we've been doing that will be ongoing, but that we were capitalizing on both persons that were available, like the park prescription program moving forward with Gloria's Connections. And then when we have various volunteers within the clinic or the county system, how do we use these during the summer? And the other idea is many of us within the Bay Area know each other from a variety of different settings. And we all have this shared goal of obviously having an environment that promotes health and well-being, and keeping that kind of regional collaborative mentality throughout as we do all of these projects, I think has been an ongoing theme. So like whenever we're designing something or thinking about something, I think the team and I are always saying, okay, what's going on in Santa Clara? What's going on over in the Golden Gate region, Marin, East Bay? What are we doing? What are they doing? And how can we just ensure that if we do something, it's easily shared or applicable towards a regional approach? And then the final part of the priorities is there are some long-term projects that we definitely, especially the individual providers, myself and Sharon at Ravenswood, that are kind of our passion and babies. And those are going to be much longer term projects, but the group hasn't given up on us, even though it was great at the onset where they said, pretty much we can't do that, at least not now. They didn't quite slam the door in our faces, and they've been just quite wonderful at keeping their eyes and ears open when there's breaks, to say, okay, maybe we can, get a finger in the door this way, or, maybe we can enter through this window, in trying to achieve the providers' kind of baby projects that we kind of wanted to do with our priorities. Gloria, did you want to add?
Yes. So going back to the quick win, as a local health department, having in our work plan a deliverable of, getting a number of childcare providers on board for the preschool Shine certification. It had been a struggle with connecting with the right people to allow us to come in and do a presentation to providers and have just a broader reach in numbers of providers. And so here comes Dr. Rovina making a connection with the executive director of our county's childcare council, and it was quick and it was amazing, and I was so happy that she totally used her voice and just influence in getting our NEOP staff there and directly talking with those providers. As of now, I have connected with 4 of them, and they have begun the Shine certification process, and I have another meeting in September to talk to more providers and getting them on board. And so I was really happy for that. And that's just one quick example of how, we matched, she saw the need in our work plan, and you definitely used her to get us through the door, and that was pretty amazing. The walk with the dogs have been really fun, really fun. Melissa explained the friendship as good, and I think that this friendship or this partnership it's great because it's actually really fun, and just starting somewhere and then waiting for the rest to for us to work out, and that has been really fun. Rachel is also very responsive with email, letting us know her availability, and when I really need, which doesn't happen, something that's immediate, she's available via text and vice versa, and that just makes it really respectful of her time. Like, we respect her time, but also she opens it up to us to reach out when something is more immediate. So yeah.
Okay, cool. I want to be respectful of everyone's time, so I'll go quickly through the next slide because I don't want to go over time here.
Yes.
So the next one is the sharing the work and responsibilities. And the bottom line here is ultimately sometimes someone just had to make the call. And Nayan Patel, who I don't think is on the webinar today, she is with Gloria and is shifting to Shasta County, actually. It was refreshing in that she's like, okay, guys, at some point we just have to fish or cut bait. And we did that with an understanding of, we're being respectful to each other, and we weren't, and our communication styles at this point had been kind of open and well set. So, but a good understanding it. Sometimes we can only, sometimes we can't all have the democratic process, and just basically saying, sometimes there just has to be one person who makes the decision along the lines, and that's okay. And who that person is sometimes changes, and that's, I think, important. Who made the decision or just cut it from there was important. I think from the get-go, Gloria has been amazing, and she's like the ultimate project manager, the PM for the team, and she has been extremely helpful at setting agendas for the meetings when we have them, so that way we can really keep on track. We have a pretty clear idea after the meetings or as we go, who's doing what in terms of when we're expecting things to get done, who's going to be doing it. And the other part I think is really important is I think we have had several things we had to troubleshoot in terms of obstacles or unforeseen issues that came up. And having those regular meetings with kind of the running list of division of labor, accountability, and setting those timelines has been important. And then the final thing that Gloria had just touched upon was flexibility, both in terms of our competing priorities
as individual contributors to our team, but also understanding that, you know, even though one of us may have an expertise in one area, if someone else can help out our pitch in, it doesn't have to be limited to just that one person always doing something within their, you know, their expertise, so to speak. And Gloria, did you want to chime in?
No, we can go on to the next one.
Okay. Okay. Just for the
board.
folks, Gloria's been amazing in helping really run these things. And the last two are just quick pictures of a way, not that we are physically doing with our team, but that I think mentally we are doing when we meet. And this is actually a huddle board that we have at my pediatric clinic. So I just did a quick snapshot of our huddle board and kind of give you an idea of how we frame projects within the clinic I work at. And Gloria and I have been kind of using these types of strategies, and not just Gloria and I, but the whole team has been using kind of these tools to kind of guide what we're doing. And then on the final slide is just a highlight, and we call it a pick chart. And this just kind of helps us again with those priorities, and it basically helps us figure out what we're going to implement, where we're doing in both a degree of difficulty and impact to our work plans. And again, we don't officially have a tangible physical board like this for our project, but what we all are doing is we're doing this, and when we're having our discussions and setting our timelines and setting accountability, we're essentially doing this, and we're going, okay, is this high impact? Do we do this now? Do we do this, you know, is this even possible? What can we do? And we're just keep rearranging where things are falling in terms of what's up with the projects that we have going, and then the potential projects that we would like to work on. Corey, did you want to add as well?
No, just that as far as the board, the boards here, we also have one in our NEOP team, and so it's not exactly the same, but it just follows the same concept, and it just helps us to keep track of the projects. And just in ending, I just want to say that you know, working with the champion providers has been just really rewarding, and from the get-go, I can say that it was a really perfect match, and it's so flexible, and it just works for us. And I do feel that we have a great team, and in my NEOP role, I am able to totally be there to help move the different ideas and projects forward and to support in any way. I share you know, personally and professionally, the passions of them both in physical activity, nutrition, and reaching our target community, and it just really works, and I just hope it continues. So thank you.
Likewise. I think that's all from our perspective.
Thank you both for your wonderful presentation. I think you gave a real overview of an example of how this collaboration can work on the local level, and you guys have had lots of wonderful success. In working together to really get at your goals, and I think that was clear from your presentation. So thank you so much. Now we have time for maybe a couple questions, and I'd like to kind of jump us off with one question. I think Gloria and Rachel, and maybe Gloria, if you want to jump in on this answer, is you guys have had such wonderful success in working on a lot of projects. You know, what do you guys find most valuable to you, and what do you find most what do you find gives you a lot of worth out of the work that you guys have done?
Sorry, you want to go first?
Yes, valuable. You know, like we all know that the using the influence of the white code and having that to help move our programs going as a local health department, and it's been really valuable because there are things that we cannot say or that we cannot influence as fast as the champion providers can. And so to me, that that part of the role has been very valuable and kind of comforting in knowing that, hey, they can make it work kind of thing. Yeah.
I think for me, it's the openness of all the team players, everything from just being very upfront about what we can and cannot do and potentially how we're going to be doing this together. And then just, I feel like, especially as we all try and work towards mitigating the obesity epidemic, I feel like this is really in for the long haul. This is not a quick fix. And all of us having patience and not giving up even when we do have some setbacks. But just basically saying, all right, guys, we're all committed to this purpose, and being very open about, how we're going to do this together.
Yes.
Thank you both. I think we're running close on time, so I want to let everybody who's listening, if you have more questions for either Rachel or Gloria or excuse me, or myself on the topics that we covered today, our contact information is on this slide. Feel free to email us any of your questions about the collaborative partnerships or how Rachel and Gloria are really making this successful partnership work. And that brings us to the end of our presentation. I really thank you all so much for paying this close attention and staying with us for the whole hour. I'm going to transfer it over to UCSF to close us out for the final portion of the webinar.
Thanks, Melissa. Hope everyone can see my final screen, which is just our contact information. I want to thank everyone who's made it on the call today. We really appreciate your attendance. I will be emailing the recording of this webinar along with the slides to everyone who's on the call today. So you can feel free to contact me with any questions. All the information will be there. And thank you so much, everyone, Melissa, Gloria, Rachel, Vanessa, and hope to see everyone soon. Bye.
Thank you. Bye.
Thank you. Bye.